Welcome to the AI for Career Success video overview by Curt Robbins, where we help you get smarter than your competition. Today, we're analyzing a really significant development in consumer health technology, OpenAI's launch of ChatGPT Health. Our analysis is based on the initial announcements and industry commentary that came out around early January of 2026.
Now, to really grasp the context for this launch, you have to look at this number. According to OpenAI, over 230 million people are already using ChatGPT for health and wellness questions every single week. That existing behavior, well, it signals a massive demand for a more specialized tool.
So in this overview, we're going to break this down. First, we'll define what ChatGPT Health actually is. Then, we'll dive into its core capabilities and integrations. After that, we'll examine its approach to privacy and design, and finally, we'll consider the broader implications for the healthcare industry as a whole.
All right, let's start at the beginning by defining exactly what this new health hub is designed to be.
As the launch materials explain, this is not just another feature in the general tool. No, it's a purpose-built environment, and it's specifically designed to empower users on their personal health journey. And a key distinction here is that it's meant to support professional medical care, not replace it. That's a critical point.
The core problem it's really trying to solve is the fragmentation of our health data. This information is often stuck in silos across different hospital systems, various apps, and our personal trackers. This tool aims to create a single, intelligent access point for the user to bring it all together.
Okay, so that's the concept. Now let's see how that idea actually translates into the product's core features.
The user journey is laid out as a pretty clear four-step process. It all starts with connecting your data from various sources. Then, it moves to asking questions in natural language, provides personalized AI-driven answers, and ultimately, it aims to help users create actionable health and wellness plans.
And this is where you can see the powerful link between what the tool can do and its integrations. For instance, a user could get a plain language explanation of their lab results, powered by a platform like BeWell, and then use a connected service like Instacart or Peloton to actually act on that new insight.
Now, given the incredibly sensitive nature of personal health information, the product's privacy and safety protocols are an absolutely critical element.
ChatGPT Health establishes a separate, protected, digital space with some pretty enhanced privacy controls. As you can see, conversations within Health are not used for model training. They are compartmentalized from general chats and protected with purpose-built encryption and data isolation.
The product's credibility is also really bolstered by a physician-led design process. The development involved medical professionals from all around the world and used a rigorous evaluation framework known as HealthBench, which is grounded in clinical standards for both safety and clarity.
And to be more precise, we're talking about over 260 physicians from 60 different countries who gave direct input during the development phase. And that collaboration was, well, it was substantial. Together, these physicians provided more than 600,000 individual pieces of feedback on the model's outputs. That's a significant effort to ensure the tool's reliability and safety. So, with all of this effort poured into the design and the safety protocols, how is this innovation being received by industry professionals?
Well, industry analyst David Pollard points out that this launch signals a major strategic shift. He sees it as a move away from general-purpose AI toward more specialized, domain-specific applications. And this, in turn, raises some really important questions about future regulation and data governance in the health sector.
Olivia Deitcher offers another key perspective. She suggests that while a tool like this can certainly empower patients, it also reinforces the need for value-based care models. Those are models that focus on patient outcomes rather than just services rendered. These models could serve as a critical counterbalance, making sure clinical decisions are appropriate to the moment and not dictated solely by an algorithm. Ultimately, the central question that experts are raising is one of integration. And this leaves us with a key consideration. How will a powerful consumer tool like this coexist with and ideally complement the established professional healthcare system? For professionals in this space, answering that question will be paramount.
Thank you for joining this overview. This is where we teach you AI and help you get smarter than your competition. We encourage you to subscribe to the AI for Career Success YouTube channel, and please do like, comment, and share to help us reach a wider audience of professionals.